So if you ever need to rewatch this amazing panel, you got it. And also, if you are a member, make sure you sign in so you can receive your point for this semester.
We are 99. Come on, come on, come on. Should we stay 99 or become 101 like the 101 Dalmatians?
I think there's actually a limit for the default Zoom room size. So we're probably...
So we can only have 99.
Yes, by default.
No, it's set to 300 participants, but I think it's already 6:04, 6:05. So I'm going to ask Ian to go ahead and get started and start introducing.
Can I make a short introduction, Ni?
Of course,
all,
yes.
Thank you, Ni. And
yes.
Yeah, you know, the other beating hearts of the One Health Student Association, including Corina, and of course, we mentioned Ian and Thomas before. So a few words about why we are all here. Well, we are all here because most of you are students of the course, The Circular Nature of COVID-19, which was a course which we put together for undergraduates like you to really try and understand the moment that they were living, because living the pandemic is something that you will tell your grandchildren. And so the pandemic is a major transformational event. It has transformed all our lives, and we need to understand the breadth of this event and the importance of this event and the ramifications of this event, exactly like misinformation and how this interacts with public health. So I don't want to make a long story short. I do want to make a long story short. I want to thank Jade Williams. Thank you very much. I think that you actually injected into this group a lot of interest and excitement. Amanda Bradshaw from the College of Journalism. Of course, Rania Gollakner, who has now left the center and is a proud member, or is a proud veterinarian working in public health with the federal government. So well done, Rania. Crystal Slanzi, who is working in psychology, and our superstar Thomas Field, who you will have noticed has completely changed the hairstyle now that he's becoming famous and is becoming someone important in UF. This is his marketing skills, you see. And again, to Mark Schlackman. Thank you very much for doing this. Thank you for being here with us. And thank you for helping us engage with our students on these complex issues which touch our lives, but touch their lives. And they are Generation Z, they are the generation of the futures, they are the generation which will have to be looking for their first jobs in the post-pandemic environment. And so that is why it is important that they open their minds, and that's what I think we should be here as faculty and as staff who try to, who work so hard for their students. And with this, I would like to thank you all again from the bottom of my heart. I will be here, I will listen, and I might interject. And I would like to give the floor to Ian Culver. Go, Ian, the floor is yours and you are the star.
Thank you very much, Dr. Capua. So to begin, we are going to have a discussion on the discussion format. So what will be happening is I will ask a series of questions. And so the first question, I may direct it towards a singular person, and the format will be more informal. So anybody can jump in and offer their perspective. There is no set order. If things venture too far off topic, I will step in to guide the situation. And hopefully, the aim of this panel is to see how different disciplines interact and how we can hopefully either arrive at a solution for misinformation in public health, or at the very least, come up with an approach towards this very monumental task ahead of us. So to begin, I will just have each of the panelists give a short blurb about themselves, starting with Dr. Jade Williams, and then going down the list. And afterwards, I will give a short framing discussion on misinformation, and we will proceed from there.
Would you like me to go ahead?
Yes, please.
Hi, everyone. I am Dr. Williams. I'm Jade Williams. It's a pleasure to be here. Thank you so much for having me, and thank you for being here. I am on the faculty at UF's Dial Center for Written and Oral Communication. And as far as my teaching and research interests, I'm what we would call a communication generalist. So I develop courses and do research on topics across the communication discipline. Two of them that I think are most relevant to this particular panel, though, are conflict management and also narrative and narrative identity. And so I think that some of my expertise will kind of come out in some of the research I've done in our discussion today, and I'm really looking forward to engaging that with you.
Thank you very much. And now for Amanda Bradshaw.
Hello, everyone. I'm Amanda Bradshaw. I'm a doctoral candidate in the College of Journalism and Communications in the Department of Advertising. And my research focuses on the nexus of maternal health decision-making, social network interactions, and vaccine hesitancy. So I specifically study how mothers make informed decisions about vaccines for their children, and how vaccine hesitancy occurs on a spectrum from delaying just one vaccine to declining all vaccines. So my work began before COVID-19 was a thing. Vaccine hesitancy was declared a top 10 threat to world health by the World Health Organization in early 2019. So I studied that and how social network interactions such as Facebook, Twitter, and Reddit can contribute to additional hesitancy.
Thank you very much. And now for Dr. Rania Gollakner. Dr. Gollakner, I think your microphone is muted or very low volume.
Okay, how about now?
That's perfect.
Okay. Sorry about that false start. I'm a veterinarian. I worked in private practice, small animal medicine for about 6 years before coming to the One Health Center of Excellence. And I was the center coordinator for 3 years, and now I'm transitioning to a new position at the USDA, Animal and Plant Health Inspection Service.
Thank you very much. And now for Crystal Slanzi.
Hi, everyone. Thanks for having me. I'm excited to be here. I am a doctoral candidate in the Department of Psychology in the area of behavior analysis. So I study human behavior. So my research at this point, I do some stuff in public health related to behavior change interventions, but I also do a significant amount of research in autism. So I have quite a bit of experience dealing with vaccine hesitancy in parents, as that's where a lot of it began, the good old Wakefield paper. And so, yeah, this will be interesting.
Thank you very much. And now for Thomas Field.
Hello, everyone. Thanks for coming. I am Thomas Field, and I'm the media manager for the UF One Health Center. So I deal with all of our media outreach, working on our social media platforms, website, developing our videos, visual communication, stuff like that. And so I'm excited for this topic on misinformation, a really big topic. So I can't wait to get into it.
Thank you very much. And now for Mark Schlackman.
Well, again, it's a pleasure to join you from Tallahassee, from Florida State University, and just to cover the various colleges and universities around the state. I'm actually a graduate of the University of Miami, went to law school in Washington at Georgetown, and had the privilege of serving as special counsel to Governor Lawton Childs. I was on President Clinton's staff toward the end of his second term, and at the outset of the George W. Bush administration at the State Department, kind of made my way back to Florida through the Department of Defense Tactical Intelligence Fusion Center. So here at FSU, I serve as a senior program director for the Center for the Advancement of Human Rights. And Dr. Williams, you mentioned narratives and conflict management. Well, there's so many aspects, whether we're talking about health or public health generally, or virtually any aspect of human rights is based largely upon narratives. And many times those narratives are unfounded or at least inaccurate. And that tracks, although different subject matter. Certainly, we also engage upon health issues. So when Ian brought this to my attention again, with all of the extraordinary energy and focus you bring, I appreciate the opportunity to join you for this hour or so tonight.
Thank you very much. All right. One more thing before we get started. I will ask the audience to hold your questions until the very end, and then we will start answering them should we have the time. So to begin, we'll start with the framing activity, just to give examples of misinformation. So back in the summer of 2018, Twitter suspended more than 70 million accounts, and at one point reaching more than 1 million accounts suspended per day. And so you can see on the right as well, there is this interesting phenomenon known as astroturfing, which is essentially the injection of messaging into social media that is designed to appear as if it were organic, even when it is not. As well as that, a poll conducted by Statista found that 65% of Americans view misinformation as a major problem in our country. Next slide, please. And so here is just a short example of the kinds of misinformation that can spread in social media. And you can see that there are a varying range of intensities in terms of their messaging. So in the context of public health, you can already begin to see that people are very influenced by the things that they're presented with. And so our panel today is going to address some of those concerns. So to start off, how have you seen examples of misinformation manifest in your field? And this is open to any one of the panelists.
I suppose I can kick it off. Working on social media, it's kind of unavoidable to run into misinformation, since that's kind of where it's presented itself as the most rampant, especially as of late. And specifically with the One Health Center, because we do so much work around COVID and public health concerns, a lot of what I see, at least on a daily basis, is people sending directly to us through messaging or replying on our posts with just a lot of false content. And a lot of the times, what it looks like is just people thinking they're uncovering some hidden truth. And so they're turning to us as, you know, a platform, as a voice to kind of amplify this. They think they've discovered something that people should know about. And so they're reaching out to us to kind of promote it. They don't really ask us, is this true? They're just like, hey, look at this. Can you put this on your website? Can you tweet this or stuff like that? And that's what makes it tricky, is that you can tell these people are, their mind isn't, or their heart is in the right place. They're thinking they're sharing information that people should know about, but they've unfortunately fallen victim to some sort of false content, misinformation, disinformation. So at least that's how I see it a lot of times. Also just maybe false accusations against people, like public figures and stuff like that. I mean, we've seen under a lot of discussion around COVID, especially, inevitably a lot of political figures or people in the media get dragged into it. So that's a lot of it as well. Sometimes it's completely unrelated to whatever our source material was. It's just people clinging on to something that's popular so they can get their opinion out. So that's just a couple of ways that I've seen it personally. It's just a lot of just straight false information or maybe some misleading content. But yeah, that's been my experience with it. If anyone else has any.
I can talk about it in terms of the vaccine hesitancy or the anti-vax movement in autism. So there's a temporal relationship between when kids get the MMR vaccine and when autism symptoms appear. And if you look at the statistics, what happens is, just by a numbers game, there's going to be kids who get an MMR vaccine and within a week are going to have symptoms of autism. Not because it's cause and effect, but there's definitely a tendency for all of us, when two things occur close together in time, that we attribute cause and effect. And then there was the famous Wakefield study that came out basically with false data saying that vaccines, the MMR vaccine in particular, caused autism. So he lost his medical license. The paper's been retracted, but it's too late. The damage has been done. And so the autism one is a pretty big anti-vax movement, and I'm sure it's contributed to other, the progression of other people refusing vaccines, not just the MMR vaccine.
I would say from a human communication perspective, and particularly interpersonal communication, the discourses that are occurring on, say, for example, Facebook or various social media, obviously trickle their way into dyadic communication that we have with other people, and particularly in our relationships and those sorts of things. So clearly you're seeing some of this, creation of and exacerbation of the more mass mediated messages that then are occurring within the interpersonal realm. And that's an important part of the whole process, right? Is in influencing others are those social networks and the discourses that surround that. So we are, of course, obviously seeing that sort of thing within the interpersonal realm, and even to the point where relationships are being broken. And I mean, the divisiveness, and the polarization on so many issues, including vaccines and COVID and so forth, they're literally tearing people apart and relationships apart.
Yeah, in broad brush terms, it is really remarkable to explore the vulnerability of so many seemingly to narrative. And this could be a larger, wider, deeper discussion about what actually used to be called critical thinking or lack thereof. How do we source? What do we rely upon? And this cross cuts. It certainly focuses upon the core issues that we're discussing today, but so many others as well. I mean, for just a bizarre aside that only underscores what's being discussed today in terms of public health and misinformation. Back to the political realm, I think probably regardless of whether which way one identifies on the political spectrum, if at all, or maybe altogether off of it. Think back 4 or so years ago when Secretary Hillary Clinton was running for president, and that there was a more than insignificant number of people that immediately seemed to accept the fact that she was engaging in human trafficking out of a pizza parlor in Washington, D.C. I don't want to take our time with that, but it's just kind of one of these, like, how do you even begin to talk about what's necessary in terms of critical thinking? And then we go into the really complexities of these issues. So I think this is a very timely forum, and I already sense just by being a part of this discussion for a few minutes, you have great expertise here and perspective. So again, I compliment the organizers of the forum.
And can I add, in veterinary medicine, we have all of these similar things, but another thing that I have noticed in veterinary medicine is the influence of marketing in perpetuating misinformation. So there's a huge pet industry selling pet products, and people have a hard time telling the difference between facts and companies trying to sell their product. And that complicates medical information that I'm trying to communicate.
I would just add too, from the human medicine, side, from advertising. So misinformation is very hard to correct due to the backlash effects. So even introducing the idea, vaccines don't cause autism. You may see that in ads on social media or elsewhere, but even seeing that, people still come away vaccines and autism. So they kind of correlate the two, even though it was debunking that exact message. So it's very hard once misinformation takes hold. Additionally, research shows that these anti-vaccine leaders, celebrities, doctors, such as Wakefield himself, who's now making a profit from people following him, they have cumulatively 7 million followers on Facebook alone. So it's really difficult when you do have a movement that's gaining traction, even though it's a minority of the people, declining vaccines, at least declining all vaccines. You have this growing movement, and the individuals I study do not lack access to vaccines. They are higher educated, higher income. Typically, you're people that would be more critically thinking that are actually opting out. I deem it the luxury of choice. They opt out of vaccines based on their preferences, not based on no vaccine availability.
So where does this backlash effect come from, and why is it so entrenched in someone's mindset?
I can start if no one else wants to go. I think fear is a big one. I'm going to talk about psychology. So with autism, parents legitimately are afraid that giving a vaccine is going to cause autism. And they don't, because from a behavioral standpoint, we're not contacting the contingencies of those diseases. I've never met anyone with polio. I had the measles myself, but a lot of parents have never seen what the measles does. They don't know that the measles can cause blindness or death in severe cases because they've never been exposed to it. So there's that aspect. And then I think outside of autism, with some of the other vaccine hesitancy that's going to come into play with COVID is in some of the other populations, the African American community, the Latinx community. There's a large amount of distrust in the government or just research institutions. So I can give the example of the Tuskegee experiment, where they basically let African American men die of syphilis. But there was a rumor going around the internet, like misinformation, saying that they were injected with syphilis, which is a needle. And so now it's like, is the vaccine going to inject us with something else? And so that's not true. The whole experiment was terrible because they did have syphilis, nobody told them, and they basically withheld treatment. So it was extremely unethical. But compounded on top of that, which is already a level of distrust with institutions and healthcare in the US health system, now there's additional misinformation, which just makes it all even worse. And so I agree with Amanda that it's very difficult to correct once it's taken hold, because they've contacted sort of environmental contingencies that just maintain that behavior and those belief systems.
Well, there's additional complexity that builds right tragically upon that. When we have a concerted effort or efforts to undermine institutions and lack in credibility, we have to ask, what are the authoritative sources? As you just suggested, people disregard or diminish, whatever the subject matter might be, or a position taken. So when we have this convergence of misinformation, in some respects, we've touched upon different aspects of it, whether it's advertising to promote market share or whether it's specific mis or disinformation. And then we have diminished integrity or credibility of institutions. I mean, that's what we're grappling with right now. So, and these issues obviously cross-cut.
And so, given the idea that anti-vaccination movements and other misinformation campaigns utilize and exploit the emotional part of the brain, is it possible to utilize emotion to sort of redirect the sentiment towards something else and to encourage people to take care of their own health?
So with vaccine advertising, so what I've seen, first person testimonials do work very well. So seeing people that have been vaccinated, typically though, if you've been vaccinated with no effects, there's not much of a story, right? It's not as compelling as all of these fear appeals and all of these side effects. And so a lot of people don't talk about it. Now on the flip side with the COVID vaccine, you do see people sharing their vaccine cards on social media. But of course, privacy experts are concerned about that, right? So sharing your actual vaccine card may not be the best approach with all of your personal information, but certainly sharing this idea that you did get vaccinated, especially well-respected figures in the community, can be powerful, and it can build credibility behind the safety of the vaccine, but it's all in the matter of how the message is framed. My research also shows that two-sided messages, or messages that do acknowledge the risk and benefits, no matter how minuscule the risk may be, are much more effective at instilling that trust than messages that claim, unilaterally, vaccines only have a benefit, there is no risk, because in any medical intervention, there is a risk, even if it's just fever, rash at the injection site, whatever it may be. So acknowledging that risk and then pointing individuals to credible sources, such as the Global Advisory Committee on Vaccine Safety. They have a whole list of 70 websites that have been vetted for credibility, but those websites are not widely disseminated. And so creating campaigns to get that information out there and to point parents to those credible sources.
If I could add here, I just want to kind of mention something that Amanda has mentioned. Actually, it's already been mentioned several times here, and that's the word credibility and trust, right? Two words that I think are central. If anybody wants to, if you're listening to try to actually do something, those two words, those two things have to be central to everything that you do, because you could have a wealth of evidence and all this great stuff, but if the people that you're trying to reach don't trust you and or don't trust the sources of your evidence, then it's going to be very hard to try to get them on your side. And I think that is one of the real keys, because there are so many different, everybody's different, right? There are all these different, sub factions of what people think and don't think, but ultimately you can't just have a one size fits all. You've got to know and understand what the misinformation is, and specifically what that, what's preventing them from buying into your argument, in order to have any kind of hope and being effective in your persuasive appeal, which is what you're talking about. All the way around here, you're talking about persuasion. How do you persuade people one way or the other? And the massive major thing here is going to be credibility and trust, and who you get to be your spokesperson, those opinion leaders, right? And getting them to voice and make changes in the narrative discourses that are going on. Critical moving forward.
I think that's really key to picking your spokesperson, because if you pick a spokesperson and that person has a learning history with anything that resembles that person, I'm a you know, I come from an academic environment and I come from a healthcare and I wear the white coat or whatever it might be, it doesn't matter what you say because it's already associated with, I don't trust you no matter what you say. Whereas if you select somebody where there's a history of trust because it's been built over time, then the message was way more likely to be received.
So how would you tailor messaging towards specific demographics in a way that would make the messaging more acceptable and would actually resonate with them?
We have several people on this panel who are experts in different ways, right, about the question that you're asking, which I think is really great about this particular panel. We kind of bring a little bit of a slightly different look or appeal to it. But I think most of us would agree that, you know, there are two central factors here. One is the individual, the audience, right? But the audience is made up of individuals, right? So the individual that you're trying to connect with, and then the other is the message itself. And both of those things are incredibly complicated. But the key is matching those two, right? So from the individual perspective, you have everything from demographics to personality traits and all these things to make, you know, what are the differences in information seeking behaviors and, you know, all these other things to social networks and the discourses surrounding them and how willing they are to go outside of certain things and their own comfort with uncertainty. I mean, there are just so many things, right? Just individually, but then there's that message component as well. And the key is matching them. So, you know, knowing your audience is so incredibly critical. Know what they know, what they believe, how much of what their behavior stems from fact kind of based versus beliefs and values and those core things, because you're going to need to take different approaches, right, with those sorts of things. Right down to, you know, how salient and how self-efficacy and locus of control. So I think those are the two critical things though, and it's about matching the appeals, okay, and the credibility and the people you choose as the spokesperson, all that to the audience and to the individual that you're trying. And again, there's so many. I think that's one of our problems is you can't just put out one mass message and have it impact everybody that you need to have impact. It's not like that. This is a very, very complicated and divisive issue, right, that we're talking about.
Yeah, for sure. And just even talking about social media, one of the big problems or to tackle that that strategy that Dr. Williams is talking about, it's even more difficult because people have the attention span of almost a second on social media. So how do you grab someone? You have an important message and maybe you're trying to appeal to emotions. How do you appeal to someone's emotions in 1 second? You know, how can you generate some type of content that's going to appeal to your specific audience immediately to draw them in and you can get your message across? And so that gets really complicated. And like Dr. Williams was saying, it depends on your audience, you know, how much they know. You don't want to be talking down to them. You have to understand like their education level or even demographics, you know, what country are they from, all these different things. And so a lot of research does have to be done on your side, looking into your audience, into your demographics, to tailor those messages. And also, especially today, we need a bigger push towards, I think at least, a bit more visual content, more grabbing content that, you know, sometimes it might seem, especially to a lot of us younger generations, it might seem a little cringy when you see like, you know, big companies using memes or something like that, but it could prove effective to use those conventions that we see in misinformation. We see misinformation campaigns using things like memes, you know, making fun of different public figures or using humor. Humor is an incredible tactic on social media to grab people's attention. And a lot of times you think, oh, it's just a joke, it's just parody, but it starts to, you know, implant ideas in people's heads if they see it enough times, which is what social media does. It kind of hits you the same content over and over. And so we just have to find a way to utilize that environment and create content that can, you know, grab the people we're looking to target. And that's why we need to be a little more specific, I think, with our messaging, based on who we are, what our organization is doing, find that specific audience and find a way to visually captivate them.
If I could just mention also, Thomas, because what you're talking about really just adds on a whole nother layer of complexity, right? Because especially when you're talking about social media, and you're talking, you know, because you might have the perfect meme, right? To attack, you know, to grab a hold of that audience you're looking for, and you put it out there, and in the meantime, it offends or turns off half of all these other people. So, you know, when you're talking, especially in a social media kind of type of world or mass mediated kind of thing, you've got your target audience, yeah, but you've got all the other audiences that are going to be impacted by that discourse that you're beginning to create or trying to shape with one, right? So it's just a whole nother level of complexity.
All
I
right,
just
so-
wanted to add just about message framing. So just since that's what I study, so I really think a neglected audience with vaccines is vaccine acceptors. So much research focuses on vaccine hesitant or the declining population, but the ones who decline vaccines. But the issue is that vaccines, it's an ongoing choice. So just because someone vaccinates one child at one time in one context does not mean they will continue to vaccinate future children for different diseases, different vaccines. So being mindful, it is an ongoing choice. And I think too often vaccines are a victim of their own success. As Crystal was mentioning earlier, you know, we don't see polio on the streets so much in the United States. And so we very much have this Western lens that gives us that luxury of seeing more focus on side effects, you know, more focus on these perceived adverse events following immunization deemed AEFIs. So sometimes that cause and effect is there, sometimes it is not. And so really looking at the audience who is already predisposed to vaccinating, they have been vaccinating. So my work helps to transition them into advocates. So helping to share with others in their network. And then you would need a different type of message for those fence sitters or those who are declining. You also have two types of populations who decline vaccines. And this is again on a big spectrum from declining one vaccine to declining all. But you have what is known as reformist. So those individuals perceive that their children were vaccine injured. They are pretty disinclined to getting any future vaccines versus those that are just doubting or they've heard from someone else. Then you have different type of information seekers. So you have your searchers who like to read all the information for themselves and they search and search. They would go through that whole list of websites I just popped into the chat for you guys versus your reliers who tend to go to socially available sources and what their friends are doing and looking at in-network connections. So you have all of these different audiences, even on the spectrum. So really targeting your messages is a big key. Yep.
Well, just to add to the difficulty, we all have the whole love of confirmation bias where we like to seek out information that tells us we're right because it's very pleasurable to be right. And so you have the other hurdle of now people are just going to look for this stuff that confirms what they already think and get on those groups on Facebook and chat with those people who it just gets in there and you just, yeah, we all agree, it's great. And so that's the other massive hurdle.
All right, and so what are some ways that policymakers could restore, given that distrust is such an essential part of people rejecting public health practices? How could policymakers restore institutional trust in the face of misinformation? And so this would specifically be looking at the implementation of the things that were previously talked about. So from a legal standpoint in terms of government initiatives as well as a public health campaign, how could somebody utilize or mitigate some of these previously touched on topics?
Ian, I think you ask really important questions. There's an aspect of this, though, that rightfully presupposes that the intent or the agenda is transparent, because we've just been navigating, again, regardless of where one may be on or off of the political spectrum, we've just been navigating through a time where there may be answers to the questions that you just posed, or at least possible steps toward answers. But but the motivations, the objectives have obfuscated those and actually contributed to the complexity by undermining the credibility, things that we've already talked about briefly. So there is a way forward, and certainly within the ambit of human rights, a lot of these issues, again, including but not limited to public health, there's vilification, there's misinformation, there's the dynamic of fear and how that will dramatically affect people's willingness to do or not to do things. But I think to step back, there should be a using the words again, a credible determination as to what legal issues there might be, because it's often overstated that, well, for instance, the First Amendment allows a wide, broad range of misinformation. That's not necessarily the case. And we could look at policies. You and I talked before this forum just about some of the history, the fairness doctrine and the then Reagan administration receding from it. And you were getting countervailing views. So I think it goes back to doing the due diligence and a number of things that panelists have already mentioned. It's not easy, but it's possible to get the law and the legal implications right, to get the policy implications right. And we'll need to align this with someone who is deemed to be credible. So I think that there are steps. And then when you see a dramatic shift from, well, for instance, one administration to the other, there seems to be a retrenchment, but there's also opportunity. So I think the timing of this forum is particularly important right now. And I mean, is there any more specific answers maybe to Ian's really important questions about essentially how to align the response?
One avenue that I see, or something I think that really needs to be addressed, and it's kind of started already, is working directly with, speaking about misinformation, with the social media companies themselves. And so earlier in 2020, there was a meeting that some of the big companies like Google, Facebook, WhatsApp, like they met with the WHO to talk about the infodemic, the way too much information about COVID and misinformation, and what they could do to help combat that. And I think there just needs to be more of that, more direct contact between, for example, public health institutions and these companies, because as we've seen in the last month, for better or worse, these companies kind of control the flow of information. Twitter and Google and Amazon they have a sort of monopoly on the internet in terms of they get to decide what is banned, what information is allowed to spread, and what cannot be spread. And whether or not where you fall opinion-wise on what they've chosen up to this point, they have that control. And I think it's hopeful to see that they have met with the WHO and they have taken these steps. If you see a tweet or if you Google or COVID or something like that, the CDC website will pop up at the top and they'll say go to these official sources. Every time we upload at the One Health Center any video that has COVID in its title, or if COVID is said during the video, it automatically has a banner at the bottom that says go to the WHO website for the latest up-to-date information. They have all these disclaimers. So they've taken some steps towards trying to get in front of it and, trying to ban some misinformation that they find. But obviously there's still a lot of work that needs to be done with that. And I think it's just—
Thomas, what would you say is the best way, not to make it even more complex than it is? I often say the goal is not to make it easier, it's to make it accurate, which takes us back to the complexity. But what would you say is the credibility check for the public health institutions or institutions broadly? Because again, we've just been navigating through a time where sometimes the information that flows to the public could be subject to some scrutiny. In other words, credibility issues there. So So you were saying more kind of transparency or communication between the public health institutions and these larger corporate platforms. But what do we presuppose the credibility of that information, or just how do we get there to be satisfied that the information that's flowing is actually information that's credible?
Yeah, that definitely does add a very, very richer layer of complexity onto it. When we talk about how credible, all are our public health institutions. Because if we look back at some of their messaging, the CDC, has had a couple of goofs in this pandemic, we can admit, especially with their messaging about wearing masks and things like that early on. And I think it goes back to Ian's question of how do we restore this institutional trust. And, I'm not sure exactly how we can, I guess, double check on the information other than just having faith in the people we elect and the institutions that we hold. And so I think that, again, kind of goes back to mobilizing people to vote and things like that, having more of a role, an active role in, who is developing this information or who is actually, working towards these solutions. I don't know if anyone else has any other input on that or how we can tackle that, because it definitely is complicated.
Well, and just one more to follow, and then I'll pause. But this raises an issue, and it's fairly compelling, but we could just note it and set it aside. It's the question of, there are facts that are often elusive, but whether, as you mentioned in the election cycle, we tend to be somewhere in this grid of 45 to 55% one way or another. And so is the truth owned by 55%, and that can flip. So, it's one of these, it's taking steps forward to lock in the credibility, notwithstanding, which party may prevail, because then if we, I think that the challenge of relying solely, and that's not what you were saying, I agree with what you're saying, but the challenge of relying upon, the elections turning out the right way is that, make up a number, 45% of the people might think that whatever is being said is suspect. So we're dealing with all of these dynamics. And again, that before we even get to the actual issues that a number of our panelists have mentioned. So challenging.
I think, unfortunately, with policy, sometimes it is, in an ideal world, it would be great if we could frame all our messages and build trust and everyone would just get on board and do the right things for public health. And then it would be, everyone would be happy and it would just work out well. But I think sometimes, unfortunately, we do have to use consequences. Like, for example, the state of California years ago implemented a mandatory vaccine law where if you want to send your kids to public school, they have to get vaccinated. No more religious exceptions. You have to basically prove that your kid is going to actually be in physical harm if they get vaccinated because they have compromised immune system or some other illness. And so, smoking indoors was another one. Wearing seatbelts. Most of the people in this room are probably too young to remember, but seatbelts was a battle, getting people to wear seatbelts. People did not want to put on a seatbelt. And now that it's become the norm, it's not really a big deal anymore. So sometimes to get that push over the hill for policy change, you do need policies that actually just fine people or make things mandatory if they want to access certain services.
And so this next question is more of a public health focused question. It was submitted in actually one of the forms. So somebody said that there has been a public sort of break in the perception between public health officials and scientists. So specifically referring to Dr. Fauci, people tend to have this sort of skepticism towards public health officials, I think in part because of initially they said that people should not be wearing masks when the intention was that, oh, we need to not buy masks so that the health professionals can get them when there was a terrible shortage at the beginning of the pandemic. And so they eventually went back and said, yeah, masks do work. But by then, the damage had been done. So when it comes to these mistakes in public health policy, what is a way to properly address past failures in a way that does not completely burn the bridges? It's a very long and difficult question, but take your time.
So I think I'll take a stab at this one. So with the crisis communication, 101, the CDC has a wonderful course on this. It's a free course on crisis communication management, but it talks about situations like the pandemic that we are still undergoing, but at the beginning of the pandemic, just acknowledging what information is known and what is not known, and that information, science is ever evolving, right? So it's not perfect. And so with the mask situation, that's a perfect case in point, like, hey, ever since, we had, wanted to control, the pandemic from the beginning, making sure health experts and professionals had access to the personal protective equipment they needed. However, now that the supplies are there and people are going out of their homes more, masks are essential, masks work. And so tailoring the messaging to have that degree of humility, kind of explaining like, hey, as we're learning more, we're giving you more information. And I think that many of these organizations do a good job of that. They typically do practice what they preach in terms of the messaging strategy. Now, how many people, again, once that misinformation is out there, no matter the intent behind it, it is very hard to change people's perceptions. So you're absolutely correct that some people may be going back to that earlier messaging and saying, hey, wait a minute, you said it didn't work. Why would it work now? So I think just having that degree of honesty and transparency, being as authentic as possible when delivering the message, and also being honest about what parameters they're working with. So what is known and what is unknown? What information do they have at the moment? And so I think that is really the best messaging strategy going forward as far as framing. Now, the actual content, of course, could vary based on your objective.
And then another question. So this is more of a prevailing public sentiment question, but specifically regarding the topic of big pharma. So there has been a lot of mistrust dedicated towards the medical establishment due to past violations of public trust in the pursuit of profit. So for example, the Sackler family, Purdue Pharma, and the OxyContin opioid crisis, when situations like that occur and there was a relatively minor punishment slapped on them for that, it definitely seems to undermine how people tend to perceive medical technology in general. And so what is a way that, in terms of policy, that we can ensure that corporations do not cause, I guess, the public to be distrustful of these things? And this is more directed towards Mark.
Well, I was thinking when you were asking the question, I mean, there are so many, yet again, narratives, so many stories, so many histories. I mean, the not to disparage corporate America in one broad swath, but we can find many stories of dealing with within the health and the drug or pharmaceutical industry, but also beyond. I mean, you may at least recall hearing about or studying, Ford Motor Company years ago made a car knowingly that would explode. And it wasn't, and that was the Pinto, by the way. And it took litigation. As a lawyer, I guess I'm disclosing some bias, but it took litigation to challenge the system. It's not always the answer. In fact, there may be more effective ways apart from litigation, but sometimes, you know, whether it's directly relating, Ian, to the question that you posed, you know, there could be oversight. There should be, you know, the process of challenging the narratives and determining credibility. But sometimes it will just take a lawsuit if a corporate entity is unflinching in its indifference to, we could say, humanity. So that's at least one option, but certainly as a lawyer, I'm not saying that that's always the best option.
All right. And so this is more towards the individual side of things, but compare and contrast socioeconomic factors and psychographic factors when it comes to the susceptibility towards certain types of messaging. I.e., which one is more impactful?
I don't think you can say one is more or one is less. I think it depends on the situation. I think it's extremely complex. As we went back to targeting, knowing your audience, you might get somebody who is low socioeconomic status who gets all of their vaccines, and you might get a very wealthy person who doesn't get any of them, or the opposite, depending on what the vaccine is, what the situation is, or what the misinformation is. I also, too, I know people who, we all know people who, some sources of misinformation, they gobble it up, and then other things they don't at all. They're extremely critical thinkers. So I don't think it's black and white either in terms of individual people. Like, this person is susceptible to misinformation completely and entirely, and this person is not. We all are a bit or a lot, and it's definitely a range. And I think depending on the specific issue, like somebody might be really susceptible to misinformation around vaccines because of a personal experience or history, and not susceptible to misinformation about other things. So it is extremely difficult, I think, to pinpoint one over the other.
Yeah, it's worth mentioning that a lot of people that do fall victim to specific misinformation campaigns sometimes are very well educated, wealthy. They have access to plenty of resources. So it's not like they, you know, don't have access to information. They just, for one reason or another, fall into certain campaigns online. That could be because of social media algorithms and just falling into those echo chambers that you know, the platforms are kind of designed to keep you in. And so, yeah, I think it's like Slanzi was saying, it's not so much a specific set of factors that will, you know, make you more susceptible to misinformation. It's more about your unique situation, or maybe what you're looking for when it comes to information. You know, some people are looking for facts when they go online and they're searching, and some people are looking for, quote unquote, the truth. And so that might lead you down different avenues and lead you towards different, let's say, sectors of the internet where information may be less accurate. This is my piece.
There's also a third person effect, right? In advertising, it's like, oh, that message affects you, but not me. Like, I'm immune to misinformation. I think none of us would say that we're immune to that, right? There's such information overload out there on the internet. There's so many sources out there. It's very important to check your sources, especially now with things like deep fakes, and you have all of this technology. Some of you may have seen the man who fixed his image in a Zoom meeting so his bosses thought he was at work every day, and he even had his reactions to meetings and the questions his boss would ask pre-recorded, so they thought he was there. It took them like 2 weeks to figure out that wasn't actually him on the Zoom call. So all of this is happening in our environment, and so I think it's really important to keep that in mind and to be mindful of countering it, you know, with these diverse audiences, with diverse belief systems and things of that nature.
I could also kind of chime in on this discussion about, you know, being prone, and again, the fact that we all are, right? We all are you know, able to be taken in by misinformation. In fact, there's probably a pretty good chance that every single one of us at one point or another has believed some information that was not true. Or that later, I don't even like to use the word true, okay, at all. I try to avoid it. But information that then later you found other information that made you question whether or not the validity of the information you originally believed. And the reason that I wanted to put my 2 cents in here is we're talking about narratives, right? And we're talking about even the term victims, right? Victims of misinformation. One thing that I hope everybody, because I can impart on you all here, is to be mindful of your words. What you communicate is the narrative we're talking about. It is the discourse. We are part of that, and we're shaping that discourse. It's not just the people on social media. It's not just the people that are, you know, that are the news companies that are doing mass media. We are, and right here, right now, and the languages that we're using, and we need to be mindful of how our language choices shape the narrative. And so when you use words like victim, okay, that immediately puts like there's something bad about them. First of all, it's an us versus them, and they're the ones with the problem and I'm right. Okay, remember, those people, they believe their information as much as you believe your information. Okay, so, you know, it's important always to try to be mindful of the words that we're using and how we're positioning ourselves according to other people, right? Because the words we choose, whether we're talking to other people or about other people, either one, it's doing the same effect. It's creating these narratives and these discourses, okay, that shape our worldview, okay, and what's acceptable or not acceptable. So to use Thomas's phrase, that's my 2 cents, right, in on that particular.
Somebody left a comment related to what you were just saying that I thought was really good about trying to have tolerance and trying to understand how people might have arrived at a situation where that misinformation or that information is for them more valid than other information. Because until you can understand how they arrived at that point or how that behavior came about, you're going to have a really hard time changing it. And so I think that was a really insightful comment, whoever left it in the chat.
One of the questions that I was asked was about kind of how do we, and then, you know, how do we make a change? How do we negotiate with people, right, who have this information? And the number one thing on my list is listen. It's not how do I argue my point? How do I convince them to my side? But rather listen to understand what these things are that they're holding so near and dear to us. That's the only way that we can then begin to communicate, and not to be like, oh, well, what's wrong with them and where are all the wrong things, but to genuinely want to know, to understand what these people live. Once you begin to understand, then you might have a chance at connecting with them.
I think that's right, because it's not it's often not a question of whether I have the quote right facts or you have the right facts. There's so much more to it, so many dimensions to it. The rationale. I mean, a quick different example, but just to come back to this, among a number of issues that I've weighed in upon, and many of you may be familiar with it in varying degrees. Someone that goes through, so apart from health, but someone that goes through the criminal justice system, was convicted of whatever felony in Florida, loses essentially their civil rights until they're restored, including voting. And that's been a huge issue in Florida. So the point by analogy is not to get caught up in that ongoing challenge, But so many people, based upon similar facts, thought that someone forfeited their voice forever because of prior transgression. So you have to kind of circle that, which is analogizing to what you were just saying. You have to really delve in. Well, who will this advantage or disadvantage? What if someone completes the sentence, they have to re-enter society? Why would you keep them down if they need to sustain? It's better for all. So it's actually a re-engineering of thought and in a process, in addition to just that this fact versus that fact. So that complexity, it also brings opportunity. It's something I think to be heartened by, because I think just the perspectives, the talent, the research just that's been represented on this quick hour. I mean, there's a lot of cause for encouragement here, and in terms of trying to kind of change this dynamic that we're focusing upon today. So anyway, I appreciate your 2 cents.
All right, and then this is more of a international arena. So do you have any recommendations for addressing concerns of international populations when the best or most accurate information, according to their government, differs from what is shared in the US? And also, to what extent is foreign misinformation campaigns, or to what extent is misinformation in the public health arena influenced by foreign policy objectives? So that would mean like another country attempting to destabilize the United States.
Well, just a broad brush point of entry there. There could be a range of different objectives, and certainly it could be nefarious objectives, international objectives, but not always the case. See, when we get into delve into the international arena, the challenge for these and so many other issues is, we'll hear, just like in terms of who can say what to whom in the United States, we hear First Amendment. In terms of international engagement, it's sovereignty, and how we can quote respect sovereignty, or how we must respect sovereignty, and what are the implications of that. That, for example, I mean, some make the case, and I'm not talking about a particular nationality, just a thought process, that sovereignty actually would trump universal human rights. So I think what we're saying, without going down to that analysis, if we can presume that human beings are, the rights that apply are universal, I think we look to the international institutions and to see how effective they can be at weighing in. I was invited to speak in Rome to the Rome Bar Association about the implications of privacy and messaging. And the government of Italy was taking up, to what extent, it's not really a First Amendment issue, but to what extent could it or should it attempt to manage the messaging? So Ian, this turns it right back to the question. The Poynter Institute, I'm just looking at this without delving into it, because I think we're probably edging to the end of the hour. But so many different approaches across the globe in terms of trying to, quote, crack down, use law enforcement, legislation, task forces, different NGOs, threats, court rulings. There's so many pieces to this puzzle, but I will just pause on this by saying I think you highlight yet another important set of issues. These could be looked at through national security optics as well as human rights optics, and how it affects all of us in the United States individually and together. So I think what you're doing in a very compelling way is laying the foundation for many more of these sessions that you've created, because they're fascinating issues.
All right, and then this will be my final question, and then I will hand it off to Dr. Capua for the epilogue. So, Dr. Gollakner, what are the steps that go into the formulation of a public health campaign?
Like the formal steps. I'm not sure what you're asking.
Or considerations and implementation.
Yeah, so I think it's everything that we've talked about tonight. I mean, a combination of understanding the message that you're trying to communicate, involving all your stakeholders and understanding the audience that you're communicating to, listening to everyone's concerns. I mean, it's a compilation of everything that we've discussed tonight. You would need to apply to a public health campaign. I mean, the health part is almost the smallest part, because it's the easy part, like knowing what we need to do health-wise. It's everything else that we talked about tonight that would need to be incorporated as well.
Okay, and Dr. Capua will be giving the epilogue.
Yes, thank you. So thank you, Ian, and thank you to all of the speakers, the panelists, the organizers. And I'm not saying it just because this is a conference, because this is not a conference. This is a student group that has still, I don't know how many students connected, 38, but we were all the way up to peaks of over 100. And so my thanks go to you. But the point I wanted to make is just taking up from what other people have said, and actually using the words that Dr. Gollakner used, which are everything else. So when I was young and much more beautiful than now, and I was working on preparing, and this is a joke because it's like when I was young and beautiful, so it's a song. I know this is one of the things that doesn't translate, okay? That you say a joke and people think she's crazy. This was a joke, okay? Right. So when I was young and beautiful, and I used to work on public health, real life issues, we had to deal with the problem in itself and with what we knew about that problem. And we had to communicate the things that we knew. And our biggest issue and concern was we had to get that information out there. And that was it, right? So it was about delivering the information. Of course, the messaging needed to be correct, and you couldn't, you know, you needed to know what you were communicating about, but it was really about how do we get the message out there. Now, how we get the message out there is like 1 millimeter. It's like a nothing. We are challenged with a whole new set of circumstances that actually make what is happening in the connectosphere much more relevant to what is happening in the real world, and not vice versa. Because the truth, lies, things that are said because they want to achieve something, because there's manipulation out there, is influencing people's behavior, right? Through a communication of an extent that like nobody knows anything about. Nobody, because we are in the most measured event in human history, right? Most measured. So there's data that's coming out of everywhere. And we are in a phase in which social media are growing and growing and growing, and certainly cannot be comparable to what was happening in social media 10 years ago. And so we have a jungle out there, which is everything else. So we need to be aware that in the future, misinformation is going to be a bigger and bigger and bigger problem. Why? Because there are parallel spirals of discourse that we are not able to follow, plus a series of other things like the polarization, the political polarization of, in this case, the pandemic. So what I'm saying is that there's a lot of jobs for you out there. There's a lot of new jobs out there, because these are all things that we're going to have to learn, and that will give opportunity to students who are interested in crossing disciplines. Because the biggest, I think, challenge that we have is that we need really to get the strength of a multidisciplinary approach, which was so clear during this panel. And so I would like to thank the two One Health ladies, Nee and Corina, again, and Thomas Field very, very much for putting this together, thinking about it, working with the students, and being, I have to say, an outstanding media manager. So yeah, thank you. And I look forward to having more of these again before I get completely old. And this is another joke. Okay.
Okay, so I'm so sorry the panel went just a little bit over time. We had a lot of great discussions going on, and I'd like to thank all of our panelists for coming. We really do appreciate all of your time and input. And as for the students, or even anyone else like professors that are participating and you are interested in future events that are that incorporate all sectors of One Health, whether it be animals, humans, or the environment, you can go ahead and scan our QR code at the bottom left, and that should give you all the links necessary to any future events that we may have, newsletter signups, and recordings of past events. Thank you everyone for showing up. We really do appreciate it, and we hope everyone had a good time.
Thank you, everyone.
Thank you for having me.